All right, I'm a talking Christmas tree, and I want to talk about Alberta and COVID. And my qualifications are I'm a talking Christmas tree. I'm not here to be the last word on coronavirus. I'm here to call something out, and hopefully, people smarter than me, smarter than a tree, will be able to follow up and do something about this. So the first thing I want to call out is when talking about Alberta politics, it's interesting to know these terms: push-pull, leading question, astroturfing, and the Dunning-Kruger effect. I think these terms are very useful when thinking about Alberta politics, but we'll get into why. What I want to focus on is two shows that the Premier of Alberta participated in with Danielle Smith. The first was on November 30th and December 15th. And these dates, the vaccine is already more or less in flight, which puts these conversations in a context and what's going to be brought up. And the first claim that the show brings up is about the PCR test. And in the show, Danielle claims that the Alberta PCR testing is somehow problematic. And we'll just get into this. This showed up on Jason Kenney's Facebook page on November 30th. I believe the Pfizer vaccine was already coming to Canada, already coming to Alberta, had already been acquired by Trudeau at this point. So let's just get into why PCR testing is even discussed.
All right, I've got a number of listeners wondering if alternative information is getting through to you, like the PCR test. Are you aware of the problems of the PCR test?
Yes, I read the New York Times report in September, I believe it was, which concluded, I think they thought that 90% of the PCR tests which they assessed with scientific experts were below the threshold of being infective. So infectious, pardon me. So yeah, I have read about that. And
so
I've raised this with the chief medical officer, and we're following the standard protocols in terms of PCR. I've raised that. Ultimately, it's up to our medical experts to determine what the protocols are for testing.
Okay, but as I understand it, even Dr. Fauci has said that if you go above 33 amplification cycles, you're going to risk having dead viral particles picked up as well as live viruses. And as I understand it, Alberta's set at 35. So it seems like the sensitivity of the test is going to be engineering the same problem that was written about in the New York Times.
And that may be the case. The reality is that I'm going to follow scientific expert advice when it comes to things like this. I'm not qualified to determine the optimal protocol for our testing regime. I do think it is good that Alberta has led the country on testing. We have consistently had highest per capita levels of testing. I know that some people claim, well, that leads to false positives and feeds into so-called COVID hysteria. The reality is that testing is one of the most important tools we can have to identify problematic cases and to limit the spread.
So Daniel raises a bunch of things, and Jason Kenney responds by saying that he's seen most of them. It's kind of weird that we're kind of Monday morning quarterback about the PCR tests. So let's get into what the New York Times actually said. So let's just read this article that it wasn't actually September, it's in August. Let's get into, let's just learn about the PCR test for a second. The PCR test, and I apologize for any cat noises in the background, the PCR test amplifies genetic matter from the virus cycles. The fewer test cycles required, the greater amount of virus or viral load in the sample. The greater the viral load, the more likely the patient is to be contagious. In three sets of testing data that include cycle thresholds compiled by officials in Massachusetts, New York, and Nevada, up to 90% of people testing positive carried barely any virus, a review from the Times found. The FDA noted, so that's kind of, if you read that, you think, okay, barely any virus, that's kind of strange, right? But it is a positive test. They did find virus. It's whether it's whatever the cycle count is, they find virus. It's anyways a positive test, positive result for finding the virus. the FDA noted, and here's the kicker. The FDA noted that people may have a low viral load when they are newly infected. A test with less sensitivity would miss these infections. And then doctors say the answers for this is not necessarily to dial back PCR or something like that, but you can say, or you could do more PCR at a lower cycle threshold more often, right? So this doctor says test them again six hours later or 15 hours later or whatever. A rapid test would find these patients quickly, even if they're less sensitive, because viral loads will quickly rise. So they're saying, maybe take the cycle threshold down a little bit and then test them again and again, which might be medically relevant. I'm not sure, but this is what they're saying. It's like that you have a positive test for virus. It's just a matter of how much viral load you are, how infectious you are. And there's lots of articles discussing how infectious you might be. But let's get into what Fauci actually said. So here's the YouTube clip that conservative media is going crazy about. Let's just watch it.
Exactly.
All right. There have been a number of reports of patients who shed viral RNA for weeks, as determined by PCR. Doesn't seem to be infectious virus. And the real question is, are they a threat for transmission? And I'm wondering if you think we could use a cutoff of viral loads determined by PCR to say this patient is no longer infectious, can go home, can go to a nursing facility. Because right now the physicians are really having a hard time with that.
Right. Again, a good question. And what is now sort of evolving into a bit of a standard that if you get a cycle threshold of 35 or more, that the chances of it being replication competent are minuscule. So that if somebody, and we have patients, and it's very frustrating for the patients as well as for the physicians. Somebody comes in and they repeat their PCR and it's like 37 cycle threshold. But you almost never can culture virus from a 37 threshold cycle. So I think if somebody does come in with 37, 38, even 36, you got to say, it's just dead nucleotides, period.
Yeah, because as you know, we can't easily culture infectious virus. You don't have a BSL-3 lab everywhere.
Exactly.
Okay.
So is the threshold cycle is reporting out a pretty standard practice in doing a diagnosis now rather than just positive or negative? Okay, good.
Yeah, I mean, if when you go in, when I get my test, it's negative. When someone comes in and it's positive, they don't give them the threshold until you go back and ask for it.
Okay, but they've got it.
They've got it.
All right.
So yeah, he's saying I can't translate it very well because I'm a talking Christmas tree, but generally maybe you're not infectious from if your PCR comes in after 35 cycles. I don't know. I don't care to speculate, but this is what he's saying. Never does he say that the virus is not there. He's just speculating on whether you're actually infectious. And then how do other sources describe the situation, right? So here's another source that says that is addressing this, and it's saying regardless of whether a person tested positive with a high or low viral load, a positive test indicates that a person is or has been infected with the virus, which qualifies them as a COVID-19 case. The high number of COVID cases reported in the U.S. is due to a large number of infected people, not due to the PCR test sensitivity. So let's get into what's happening in Alberta, right? So Alberta stopped this interview's happening November 30th. Alberta stopped asymptomatic testing, unrelated outbreaks. If you're exposed or symptomatic, you can get a test. Otherwise, you can't. Or maybe you're a frontline worker. Maybe you get a test that way. But you can't just roll up and want to desire a test. You need to have symptoms, right? Or an exposure. So barely any virus is not the same as no virus, and people that are symptomatic and test positive after a PCR test they're almost certainly they're infectious at some point during their illness, even if their PCR test came back positive after a high number of cycles, right? Like logic says, you test them once, they're sick for half a dozen days, you test them one of those days, maybe the PCR cycle is 35, 30, whatever. Just because it's 37 doesn't mean that you want to hang out with this person and declare them non-infectious, right? That wouldn't make any sense. So, this key point, places investigated by the New York Times with the results of the higher PCR cycle counts may have been at that point doing much higher numbers of asymptomatic testing, right? So, who cares what happened in Boston or Las Vegas in July or August? Who knows what healthcare providers are doing? Maybe it's the same cohort of people that are getting tested asymptomatically. Who knows what's going on there? But it doesn't call into question what Alberta is doing with PCR tests, which is people are symptomatic or exposed, and then they get tested and they come back positive. That is a positive case. There's no way, no ands, if, or buts about it. It's just completely crazy that the Premier of Alberta is taking time to kind of like give this take merit, right? So and no matter what you think about the PCR test, you can't fudge the death numbers, right? So deaths continue to rise. I believe the count just recently was another 20 or 30 for Alberta over however many days recently. The COVID has now killed more Albertans than the last 10 flu seasons combined, right? So people are, Jason Kenney himself, we'll see what he said about this, right? So let's just watch this video, right?
Today, I'm here to announce that the first presumptive case of COVID-19 has been detected in Alberta.
The average age of death from COVID in Alberta is 83. And I remind the House that the average life expectancy in the province is age 82. Influenza that does not generally threaten life apart from the most elderly.
About all of this, and I really don't think it makes any sense to suddenly turn tens of thousands of people into lawbreakers simply because, for example, they're not inclined to wear masks.
And so currently this represents a tiny proportion of the deaths in our province.
It's clear that your approach hasn't worked to date and has arguably even cost people their lives. Do you acknowledge any responsibility and apologize for the way you've handled the second wave of the pandemic?
That sounds a lot more like an NDP speech than a media question, Sammy. I reject the entire premise of your question.
So there you have it. Like whatever Danielle Smith thinks she can outsmart the PCR test, all right, as if it's a provincial exam. But you can't, 719 Albertans died. So I don't know why Danielle Smith thinks this is a relevant point. Yeah, and this is what they want you to believe, right? The United Conservative Party wants you to believe that the PCR test complexity proves that there's a case-demic, and that's what they're calling it. You can read Twitter, you see this terrible comments all the time. And Alberta, they say that Alberta did not need to ramp up restrictions in late November. Of course, even if they get their way, even if they push the case rate down, right? It just means that the hospitalization rate and death rate for COVID or worse than we even think, right? So even if you get your way and you say, okay, instead of 1,000 cases, we actually have 500 cases, well, that just makes the death rate that much worse, right? So I don't really understand why people are wasting their time thinking about the PCR tests and cycle thresholds, right? It's the end is the same. It's like you have a certain death rate. There's an active virus traveling amongst population. You want more information rather than less, and nitpicking these cycle thresholds is not useful. Yeah, so it's like, and let's get back to reality on what's going on with testing in Alberta. Is Alberta has no idea how many people are COVID positive, and no authority potentially on the continent of North America has ever done sufficient testing to get a complete, accurate number of what's going on, right? The number of reported in any jurisdiction has been an undercount, right? PCR tests that are only positive after a certain threshold, or that means they're not currently infectious. But, Alberta is only testing symptomatic or exposed people. These people are very likely to be infectious. And, any way you cut it, the death toll is rising. So let's take this seriously. And if you disagree with the undercount, you can look at the numbers for Washington State, New York, where you had early on in the outbreak, you had high death counts with low case numbers because there's community spread. You don't know how many people in the community have it, and then after the fact, the antibody tests and all this is not accurate. So we really don't know how many people in Washington State, in New York, California actually had this virus in February, March, April of 2020, right? But we knew going into it what the death numbers were in long-term care homes, right? So the answer is always more testing, right? More tracing. And I don't know why Danielle thinks that she can outsmart the PCR test. And then this is the next thing, is Danielle thinks, and the second claim is Danielle wants everyone to be on an ivermectin treatment protocol. So let's get into this another thing that came up November 30th.
Why doesn't AHS or Dr. Dina Hinshaw have a treatment protocol for frontline doctors? If the goal is to keep people at home and care for them at home, I've read it. It basically says drink fluids, sleep, take Tylenol if you can tolerate it, and let's hope you don't have to go to hospital. There are other treatment protocols elsewhere to deal with the issue of respiratory restriction and also deal with the issue of blood clotting, and yet it doesn't seem like there has really been any direction to doctors. Why not?
Of course, doctors get direction, and their college shares best practices with them. I'm not quite sure what you're asking me to provide in terms of additional information. I think our physicians know how to take care of their own health.
Well, I guess the issue is like vitamin D in the UK. They have just delivered a course of vitamin D to those who are most at risk because they found that 80% of patients who turned up in ICU in Spain were deficient in vitamin D. We don't have any direction on that.
Right.
There are also two protocols that I've seen, one from the East Virginia Medical School and another from a different medical school that talk about doing pulse oximeters so that you can monitor oxygen, and also giving steroids in the event you've got respiratory problems, and then also dealing in the issue of having anti-blood clotting agents in the event you start ending up with that problem. None of that exists in the direction of doctors. They're very frustrated about it because they mention it to me that they can't get approval to prescribe anything to their patients. And I'm just wondering, if we're trying to keep people out of hospital, that would seem to be a pretty obvious place to start.
Well, Danielle, nothing's preventing a doctor from prescribing, quote unquote, to a patient, recommending to a patient non-pharmaceutical products like vitamin D, for example, which are over the counter. And I'm sure many doctors have read those studies and are doing so. I've asked the chief medical officer for advice on that, whether we should follow the example of the United Kingdom and other jurisdictions who are providing for wider distribution of vitamin D, for example. But those are all clinical matters, and I'm going to leave those to the clinicians and to the healthcare experts.
I guess I'm worried that the information isn't getting through to decision makers. Have you followed any of the studies on ivermectin, for instance?
No.
Okay. Fair enough.
But I will tell you, I think in your general question, I spend a lot of my time on the weekends reading pretty widely on COVID developments and research, which is why I'm familiar, for example, with your questions about PCR, the studies on vitamin D, and many other related issues.
Okay, let me take a pause. We will get to some calls when we return. Stay with us on Corus Radio.
Okay, so Jason Kenney seems kind of perplexed by this line of questioning, and to his credit, no one, this is actually kind of wild, right? So let's get into what the hell is Danielle talking about, right? So if you listen to Danielle's show, you'll learn that she's been talking about treatment protocols for months, right? Absolutely. She's been going on about this all year. And the earliest I'm aware of is in March 2020, where she, she plugged hydroxychloroquine on Twitter, right? New controlled clinical study conducted by doctors in France shows that hydroxychloroquine cures 100% of coronavirus patients within 6 days of treatment. Hashtag chloroquine, right? So this is what she's thinking about when she's asking, Jason Kenney, have you thought about protocols? She is got a new hydroxychloroquine, and it's called ivermectin. But let's get into this treatment protocols, right? So you think that she actually deleted this tweet in March, right? So you think it would be done at that point, right? She's not going to take hydroxychloroquine. She's not going to be offering it, et cetera, et cetera. Actually, what happens is she goes on, and in August 2020, she's still talking about treatment protocols. So here, listen to this clip.
Number 2, for people at high risk or high exposure, including healthcare workers, early or prophylactic treatment is essential to the progression of the disease. There are some other nations in the world that do use at least 4 or 5 different types of therapeutic drugs. We don't approve them here. I'm not entirely sure of all the reasons why. But we have not made the case or we've not made decisions to go down a similar track. So if I can do some shows on what those early prophylactic treatments look like, I'm happy to pass that on. But that seems to be pretty important.
So yeah, she's kind of talking about prophylactic treatments. It's like, what is she talking about? So the websites that she read on this show, and she read about almost the entire website. She just reads things that she receives on emails from all their crazy fans, and she just read this webpage, right? And there's an archive of it, and this webpage that has the prophylactic treatment doesn't mention any ivermectin on the archive date in August 2020, right? So on that day where Danielle's reading this website, the prophylactic treatment was zinc, hydroxychloroquine, I'm going to butcher this word, but quercetin, and then bromhexine and heparin, usual dosage. I don't know what the usual dosage is, but I'm not a doctor. I'm a Christmas tree, right? So let's keep on going. And azithromycin, I butchered that probably as, I think it's an antibiotic. I think it's also called a number of trade names. They say, take all of this prophylactically, and then take this antibiotic after you get COVID, and then you're going to be fine, right? And then the conspiracy website, and then this is in the snapshot, it's like, it says, it is conceivable that the above treatment protocol, which is simple, safe, inexpensive, could render more complex medications, vaccinations, and other measures obsolete, right? So it's like, why do we need a vaccination? We have hydroxychloroquine. So this is where Danielle's head is at in August 2020, right? She's still plugging a website that says hydroxychloroquine. So why is she talking in November of this year about ivermectin, right? And then it's because the senator in the States, decided to have bring the people to Congress, and it has this one guy named Pierre Corey. And let's listen to what Pierre Corey has to say.
And I want to talk about that we have a solution to this crisis. There is a drug that is proving to be of miraculous impact. And when I say miracle, I do not use that term lightly. And I don't want to be sensationalized when I say that. That is a scientific recommendation based on mountains of data that has emerged in the last 3 months. When I am told, and I just had to hear this in the opening sentence, that we are touting things that are not FDA or NIH recommended, let me be clear. The NIH, their recommendation on ivermectin, which is to not use it outside of controlled trials, is from August 27th. We are now in December. This is 3 to 4 months later. Mountains of data have emerged from many centers and countries around the world showing the miraculous effectiveness of ivermectin. It basically obliterates transmission of this virus. If you take it, you will not get sick.
So he's saying that ivermectin is all that, right? And, so Daniel Smith brings that up in November 30th, right? And Pierre Corey is saying, you know, and you know, we're in December, it's not August anymore. Let's just give everyone ivermectin, and like we can. And these are people, you know, this is a tweet from December 8th. Everyone knows about the vaccine, and they're still like plugging ivermectin for some reason. And then not only on November 30th, but she does it again on December 15th, right?
Okay, what will you tell Dr. Dennis Modry about ivermectin? I've played on the air the testimony that Dr. Pierre Corey gave to the U.S. Senate, talking about an Argentinian study where 800 healthcare workers were given ivermectin. None of them developed COVID. A test group did not get ivermectin, and 56% or something did develop COVID. He also has 30 other studies, and he just doesn't understand why it is we can't get any government to move on giving permission to administer this. What would you say in response to him?
Well, I would simply say that I've asked for advice on this, technical advice from Public Health and Alberta Health. I'm not going to improvise. I'm not going to play, doctor here. I'm not a scientist. I have read some of those articles, and I do find them intriguing, and I'm waiting for their medical advice on whether this is something we should pursue.
So she's asking about ivermectin again. It's like, can you please look into ivermectin, this treatment protocol, blah, 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 blah. And remember, it's supposed to be a prophylactic treatment, right? So let's get into this, what her website says now. This is the same crazy website that she was reading in August 2020. That's written anonymously, right? It's called Swiss Policy Research or something. It doesn't. No one knows who owns this website. It doesn't seem to be actually Swiss. The December 2020 version of the protocol, right? It's zinc, quercetin, bromhexine, vitamin D, and vitamin C. And now the website says, or it didn't say anything about ivermectin before, and it says ivermectin may also be used prophylactically on a weekly basis. Prednisone, I butchered that word, is to be used if pulmonary symptoms develop correctly. And then here's the kicker. Hydrochloroquine is back. Correctly dosed hydrochloroquine has shown to be effective and safe for early treatment of COVID-19. So it's like, here's the prophylaxis: is zinc, quercetin, bromhexine, vitamin D, vitamin C, and ivermectin. And then if you get sick, then double up on hydrochloroquine, right? Well, like 3 months ago, if we go back, it's like they had you taking this every day as a prophylaxis, right? So when they say prophylaxis, they're meaning like all frontline, all doctors and nurses, absolutely, all frontline workers, everyone exposed, right? They're saying just take this prophylaxis, right? And then if you go to Pierre Corey's website, it's actually slightly different, right? Ivermectin, you have, it depends on your weight actually, right? So this first website doesn't get into any particular dosages, but Pierre Corey's website does. And then it's saying 2 milligrams per kilogram dose on day 1 and day 3, and then 1 dose a month if quote unquote high risk, right? And then so this is not day 1 and day 3 and once a month. Well, this other website says use it on a weekly basis, right? And just do it weekly, right? We'll get into that in a minute, but here's zinc, and then quercetin, vitamin D, vitamin C, and then also melatonin, right? These things don't even line up. And then the cited authors are Pierre Corey, and then one name that's interesting is Paul Merrick, right? So if you watch all of Pierre Corey's testimony, he talks about Paul Merrick, and Paul Merrick is this guy that people actually respect a lot more than Pierre Corey, right? So the interesting thing about Paul Merrick is Paul Merrick said that vitamin C cures sepsis, right? So right now they're saying ivermectin cures COVID. Previously, they were saying vitamin C cures sepsis. And here's this physician at the YouTube channel discussing that, right?
Study, number one. That's a problem. Whenever you have a tiny trial, it can lead you to bigger trials.
He's talking about the problems in the vitamin C cures sepsis trial.
It can point you in a direction that you may have found something, right? But it is never going to give you a definitive answer because you don't have enough power to see, is it due to chance? The second problem with this trial is that it was a retrospective before and after trial. What does that mean? What that means is that they looked back in time at a set of group of patients who didn't get the intervention and then a set of patients who did, and they were sequential. Two problems with that. It's not moving forward. In other words, you're not saying, I'm going to do a test, and I have a hypothesis, and I'm going to have a plan where I do a double-blind, placebo-controlled trial where nobody knows what treatment they're getting, and we're moving forward, and they're randomly assigned to groups. No, this was not random, nor was it blinded. And on top of that, they were sequential, which means the first group had a different environment than the second group. The group that didn't get the treatment may have been it was in a different season of the year. And the group that came after was in a different season of the year. That group that came after, who knows what could have happened in that hospital in the intervening time. So it's not a perfect trial. And on top of that, it was a single hospital. Could it be that everyone in that population was vitamin C deficient? So by giving them vitamin C, you've given them a leg up. So these are the subtleties that you have to tease out when you're designing trials and also reviewing trials, which means you can't just read the press. You have to go and look at the trial, which means we need the tools and the capacity to do that. This is why anti-vaxxers, Tom, they fail. They look at small trials, they read the headline, they don't look at the raw data, they don't have the tools to process it, and they look at us as being biased, even though we do have the tools to look at those small trials and go, no, this trial is bullshit. And that's part of the problem. Now, the other problem with this particular trial, unpacking this trial, is that the treatment group and the non-treatment group, 60% of the non-treatment group that wasn't getting vitamin C got steroids in the form of hydrocortisone. So 40% didn't. In the treatment group, everybody got hydrocortisone. So could it just be a hydrocortisone effect that's causing the saved lives in this particular instance and population? Instead, they gave nothing or a mix, like a little hydrocortisone or not, versus 3 medications, thiamine, vitamin C, and the steroids. So you're going to need more studies to show, was it the vitamin C, was it the vitamin C and the steroids, or was it all 3? Or was it just a fluke of statistics? That's how you unpack trials, and there's more you can do. But the idea that the press would say the cure has been found for vitamin C is dangerous, misleading, and it devalues the fact that we as scientists have to do better to unpack.
Yeah, so you can do your own research. You can Google vitamin C and sepsis and find out that, everyone that follows this will say Paul Merrick is a great guy, blah, 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 blah. But no one is using vitamin C for sepsis, and no one finds this finding replicable. No one's studied it appropriately, and no one's using this. And what he's saying is basically debunked, right? He's calling it fake news. And then this is a couple of years ago, I believe, right? And then or maybe 2 or 3 years ago, I think he made this video, and then the same physician has made one about ivermectin. I don't think this physician realizes potentially that he's talking about the same person, right? The same person that said vitamin C cures sepsis shows up on this ivermectin cures COVID, right? So, but he's talking about Pierre Corey. He doesn't realize that, potentially he doesn't realize Paul Merrick's in the picture. But okay, let's just watch this.
Hey guys, Dr. Z, ivermectin. So everybody's talking about this. I'm getting a lot of messages about this ever since Dr. Corey, who's a physician, went in front of Congress for the Homeland Security panel, or I think it was, and was talking about how there's a lot of emerging data around the world that ivermectin, which is a 40-year-old anti-parasitic, maybe even older than that, anti-parasitic drug, which was felt to have some antiviral activity against COVID in vitro, in other words, in cell cultures, not in the body, at higher doses than you typically give for the parasitic effect. Looking at all that data, he's saying, hey, we need to do something because this is showing efficacy in all the trials that are looking at it. And so he actually used the term wonder drug. And now everybody is very excited about this. Now, this is a group, I think they call themselves Frontline Critical Care Alliance or something along those lines. And this is how I think we should think about this, because we don't know the answer to the ivermectin question, and it has a lot of sort of similarities to what we were doing with hydroxychloroquine early on. People saying, okay, here's an anecdote, here's a small retrospective trial, here's a larger retrospective trial. In other words, looking backwards at data and going, okay, who had gotten this and who didn't get this, and let's compare the groups after the fact. And it turns out there's a lot of bias in those kind of trials that it's very difficult to control for. So they're not the best trials. So forward-looking prospective trials that are randomized, that are preferably blinded so you don't know whether you got something or not, that have a placebo group, that's really the gold standard to try to figure out is something effective. And with hydroxychloroquine, when you do those trials, it doesn't seem to work again and again and again. And in fact, even, treatments that may show some promise like remdesivir, WHO does a big randomized trial, it doesn't work. We really want to grasp onto these ideas that medications are going to save us from this thing. And that's why I think there's so much interest in this, because these are pretty smart, well-intending physicians from reasonably reputable places coming in saying, hey, we need to do something right now. Okay, I get it. People are dying everywhere. But we haven't done a good prospective randomized trial on this. So we should. So before we can call anything effective, even in any meaningful way, in this pandemic, it's not that hard to do a prospective randomized trial when there's so many patients getting infected with coronavirus. It'd be reasonably easy to get enough numbers to do a trial for this, right? Now they cite trials in Egypt and Iran, randomized trials, but looking at some of those, they're smaller, they're biased because you're comparing against hydroxychloroquine or something. You need a placebo-controlled trial or true standard of care trial. There's different ways to structure it, and we'll talk about that in future shows. But this is what I really want to impress, okay? Does ivermectin work? Maybe. We don't know for sure. Is there some evidence? Yeah. Is it strong evidence? I don't think so. Not yet. There's a lot of it, though. And one of the problems is in South America, the governments of certain countries said, go ahead and start using this. It's available over the counter. So a bunch of the population took it and they said, oh, look, we're seeing decrease in cases, decrease in mortality. It's good for preventing the infection. It's good for after you've been exposed, preventing you from getting sick. It's good for once you're sick. It's good for when you're hospitalized. But now you can't even do a good placebo-controlled randomized trial in South America because so many people have already taken the drug. These press conferences and anecdotes and social media posts and things like that, they're good for starting hypotheses and for directing us to do more research. They're not science in and of themselves. And it can actually be harmful. And I think people are looking for answers when actually the simplest things they refuse to do. Social distance, wash hands, wear a mask, don't gather in large crowds. Okay, we don't want to do that. All right, then ivermectin. Okay, there's a vaccine now that's 95% efficacious with a really good safety profile. How about that? I don't want anything toxic in my body, but I'll take ivermectin, an antiparasitic that has, by the way, potential side effects, including neurologic side effects, including interactions with other medications. So what I'm asking for here is don't shut down the research on ivermectin. Do more research on ivermectin. Listen to these guys and actually follow up and look at the existing data in depth. Absolutely, we should do that. But, and I've talked to some smart people about this, we need to do it in a scientific way that isn't anecdote-driven, that isn't emotion-driven, and we need to do all the other things, the vaccination, all the social distancing, masking, all that other stuff, because that's how you're going to get through a period where we're getting hundreds of thousands of new cases every day and increasing death rates, which again, that...
Yeah, so there you go. You can watch the whole video. The rest of it's just mostly anecdotes. But, he doesn't seem to believe in ivermectin. You can presume that I don't either. But let's just run the numbers. Let's say, what would this cost anyways? Let's just assume that Daniel Smith is right about everything, and we need to take ivermectin, right, as a prophylaxis, right? Because that's what they're saying. Take it prophylactically. There's all these people are pushing hydroxychloroquine and ivermectin. They're saying it's a prophylaxis, right? Trump was on hydroxychloroquine, or at least he claimed to take it prior to his positive test. Was it August, September, November, or October? He was taking hydroxychloroquine back in April or May, if I remember correctly. So let's just run this through. So I did some searching and I tried to find all of these drugs and tried to see what they would cost, right? So I have ivermectin. It's available, sold as Stromectol, 3 milligrams pill. And I did the calculation from Pierre Corey, and then I said this is going to be $13 to $27 a pop for a 150-pound person. Now remember the PR Corey says take this once on day one, and then again on day 3, and then maybe once a month or something like that. Whereas the other website just says, take this ivermectin weekly. So this is kind of a question of how often are we doing this $10 tab for ivermectin pills. And then zinc, it's going to cost you 6 cents a day. Quercetin, you have 22 cents a day. Vitamin D, you have 5 cents a day for the recommended amount. Vitamin C, 3 to 6 cents a day. Some of these treatments are some of these, I shouldn't say treatments, some of these random grab bag of pills or multivitamins are relatively cheap. Melatonin, 6 cents a day. And then here we go, hydroxychloroquine, right? If you take the 2 tabs that the first protocol prescribed, 100 tablets I found 100 tablets for $180. 2 tablets a day, that's $360 a day. Maybe, and you could call me on my math, or you could find a better supplier. But end of the day, that's what it is, right? It costs money. And bromhexine, sold by some weird COVID conspiracy website in 8 milligram tabs. It ends up being $6 for 25 tabs. It ships from like Norway or something, and it ends up being like on one of the protocols being like 70 cents a day for 3 tabs. So whether you're taking ivermectin every day, hydroxychloroquine every day, or bromhexine every day, I don't know. But if you take all of these things, you're costing it's going to be easily in $2 range if you're taking one of the let's say superstar drugs that they say, which ivermectin or hydroxychloroquine or bromhexine. The zinc and the vitamin D and the melatonin, these are just fluff, right? It's just stuff that you might be deficient anyways. They're going to throw it in, and they're going to claim success when if anything happens positively, and if you die, then they're just going to forget about you. So let's get into this, though. Let's talk about this. A prophylaxis protocol that costs $2 a day is at least $730 for a year. To ingest what is half a dozen pills a day. One of them is a deworming agent, which have no scientifically demonstrated protection. There's been no studies on this, and you're going to spend, $30, $60 $30 a month, $60 a month, who knows what. Just downing these pills constantly if you want this prophylactic treatment, right? And I imagine it's not going to be just doctors, right? Anyone at risk, anyone in a high-risk population. If you smoke, if you have any respiratory problems, you're going to be taking all these pills, right? And these are the people that think that masks and social distancing are too much of a pain, right? So like a $5 mask that you put on the store, they have a huge problem with. But you spend $700 a year on random pills, one of which is given to animals to remove worms, and they have no problem with that. So let's go back on this and say here's a kiwi and kangaroo plan that has been tested, right? Institute serious region-based lockdown, watch the cases drop, monitor incoming travels from diseased countries like Canada, and then their party on Christmas, right? This is what the Australia and New Zealand have already done, right? So they've already had success with this. They did a full lockdown. They did, I think New Zealand had an easier time of it. I think Australia's lockdown was something like 100 days. And coming out the other side, they have zero community spread, zero local cases. The only way they get cases is people like Canadians show up at the airport and we are sick, right? So we need to get our act together and start thinking about this rather than ivermectin. Let's take why are we even thinking about this? Why are we wasting the Premier of Alberta's time thinking about this? Why is the Premier of Alberta choosing to talk to this person? And let's go back to the snake oil plan from Daniel Smith, right? So let's force everyone to pay the equivalent of a Netflix and HBO subscription at least, right? $30 a month to receive a big bag of pills to consume every day. pretend, and then, the other thing that's classic in these conservative plans is pretend to have a realistic plan to isolate the vulnerable, like all the overweight people, all the diabetic people, all smokers, all the elderly, everyone with respiratory issues. Just imagine some concept where we have some idea of how to segment the population where these people don't interact with people that we think are going to survive COVID. I don't know how that even works. It's never been explained. It's never been elaborated upon, but they kind of always pretend that it's possible. And step 3 in this magical plan is watch people die when all goes wrong, and then they're going to just blame others for not taking the plan seriously, right? They're going to say the government didn't do enough to protect long-term care homes, but they never elaborate on how they are going to basically have an authoritarian state to make sure that no one contacts the elderly. Okay, so let's just take a moment to, at this point, maybe you're convinced that the entire population of Alberta that doesn't want to, has high exposure, might not want to be on a deworming agent like ivermectin. So I just want to piece out why Danielle Smith might want, why she keeps on hammering home these points, keeps on trying to bring this up, keeps on trying these, kind of things, right? And let's just go to how she thinks about public health in general. And here's a, I think, illuminating clip.
Now, I'm not quite sure why Bill Gates has emerged as the preeminent voice on medical vaccines, when I guess it's because he's an expert in computer viruses, although there isn't an immune system on computers. So I think computer viruses spread differently than viruses in the human population. That's just sort of my uneducated observation. But apparently he has become the world expert on vaccinations.
So, like, in case you've been, living under a rock for like the last couple of decades, Bill Gates is the co-founder of Bill and Melinda Gates Foundation. I don't know why Danielle Smith is choosing to talk trash about Bill Gates specifically and not also talking trash about Melinda. Presumably they have similar opinions about public health, or why she thinks that the Bill Gates in this role is not credentialed enough to talk about vaccines when his organization presumably spends more on public health research, or at least the research angle of public health, than the entire province of Alberta, right? On an annual basis, I imagine. I'd be blown away if that was not true. So you could look that up if you care to fact check that. But it's kind of like, why is she so invested in this, and like why is it so important for her, and why does she think that if Bill Gates is wrong, how is she talking about vaccines and prophylaxis for COVID, right? Her credentials are, if I'm not mistaken, is she has a Bachelor of Arts in English from the University of Alberta, right? So if Bill Gates should, put bluntly, she thinks Bill Gates should shut up about vaccines because he's just a dumb computer programmer. But she thinks she knows better, right? Because she has a Bachelor of Arts from the University of Alberta, and then that qualifies her to talk about COVID and the public health response to COVID in the pages of the Calgary Herald on like what is it, bi-weekly, maybe once a month. I don't know how many times she gets published in the Calgary Herald, but her name keeps on showing up. Bill Gates has yet to get a column in the Calgary Herald, but I don't know if he's not been invited or whether he has something more pressing to do with the pandemic. But Danielle Smith is there very frequently, and like let's just kind of like go on to how like what is the guide to a COVID cure if you're someone like Danielle Smith. And what you really want to do is you want to pick a drug. This seems to be the pattern, is you pick a drug that can be marketed as something familiar due to the age or simple origins, like a drug that we've always seen because we've always had it, or for at least 40 years, or the origins of the drug. It seems simple, right? So, vitamin C cures sepsis, hydroxychloroquine cures COVID, ivermectin cures COVID, and I think the MyPillow guy, the crazy Trump supporter, wanted Olandrin. He thought Olandrin cured COVID, which is basically, as far as I know, a poisonous extract of a plant. But these are the themes, right? This is always something that seems familiar enough, right? It's just a plant, or it's a drug that you have in the barn already, so it can't be that bad, right? And then the next thing they do is you gather extremely suspect evidence from bad sources, right? You have a retrospective study that looks at observational data from like some country somewhere, and then you kind of guess at what the behaviors are, and you maybe not look at the whole very extended period of time. You look at a certain period of time, and then you just make wild conclusions, right? So you start making, you claim the drug has magical properties that solve a very difficult disease. You can't just say it has a modest improvement in mortality rate. You need to just say the mortality rate is gone. That's what you always say. So sepsis, remember the Merrick study says vitamin C basically ended sepsis, and COVID is basically ended by ivermectin. That's the claims, right? These are huge claims. They're not saying that it makes things slightly better. They're saying in that paranoid conspiracy theories website, they were saying forget about vaccines. You could be on a prophylaxis protocol, and then the question that gets, the leading question, or the question that gets extracted is, why is this not on headline news, right? Well, this gets to the step 4, right? You have to claim that the deep state liberals are suppressing information out of ignorance or malice. You need to say that Bill Gates is trying to make money from a vaccine, or someone's trying to make money from remdesivir, or something like that. You need to say, are there cultural or political opponents are trying to pull a fast one on them, right? And then you need to not fund or any way bother with randomized controlled trials, right? So the point is not to find what's true and then be truthful. You want to have enough ambiguity that you can politicize the subject, right? You don't want to say, hey, you can't just come out, show all your cards, and then be right about something, right? You need to just be sort of, you have enough enough information to poison the discussion, and then continuously hammer your political opponents with it, right? And then once the liberals show up with, in this case, the liberals are the political opponents, once they have the data to show that your story about ivermectin or hydroxychloroquine or whatever is not the wonder drug that you said it would be, then you go to step 1. You find another drug, right? So the drug in March was hydroxychloroquine, and then December we're in ivermectin, right? And bromhexine and Elandrin or whatever, right? So it's just going to be the next thing, right? It's going to be, take a double dose of melatonin or some crap like that. It's about moving targets, right? And it's important to understand this piece, but it's not really about freedom. It's about dunking on the liberals, right? They don't care about what's true. They care about being right, right? And what they are really afraid of is if someone like Bill Gates is correct by, right about the coronavirus, then maybe he's also right about climate change. Maybe he's also right about economic policy, right? They don't want to read anything about that Buffett or Gates or really wants to say about tax rates or climate change or coronavirus, right? So you can't take Bill Gates' word on the vaccine, because then he might start listening to him about climate change, nuclear power, or whatever the quote unquote, liberal agenda it would be, or whatever it is, right? Whatever he is. So with someone like Bill Gates, wealthy liberal, he's a coastal elite, he's a cultural opponent, right? Same thing with everyone out east, out west, everyone is an enemy. So it doesn't matter what they say, or about the vaccines or whatnot. They're going to find the cure for COVID, and it's going to be simple, and it's going to be in their barn, right? So, especially with, ivermectin, right? So I just want to say the cure for COVID is not in your barn. Do not drink bleach. And if you want to ask Danielle Smith, You know, like, do not drink bleach. I don't know why, you know, do not drink bleach. And if you want to ask Danielle Smith, like how much ivermectin she took today, right? Because it's a prophylaxis. Even if she's not feeling sick, right? She should be taking this. She should be giving this to her family, her friends, whatever. She doesn't need to wait for the trial or the mRNA vaccine, right? She wants to take, you know, she doesn't want to wear a mask. She wants to take this ivermectin. So just ask her how much she's been prescribed from Dr. Corey, and just ask her. So her address is danielsmith@corusent.com. This is public information on her website. And so she works for Corus Entertainment, which owns Global News. And they don't give her a Global News email address because her show is entertainment. They will tell you this if you call them and ask them. The Global News people will have nothing to do with Danielle Smith. She's not in the newsroom. She's a commentator. It is entertainment. It is like wrestling. It is just political entertainment, right? So if you want to ask anyone at the Corus PR, or you can ask her on Twitter, or you can ask Larry Gifford, who is in charge of Corus Entertainment radio programming. And I just want to dedicate this video to all the Albertans killed by the incompetence of the Global News Organization and the Kenney administration. I just want to say Merry Christmas to everyone watching this, except for those watching that work for Corus Entertainment. That's about it. Stay safe, wear a mask, stay distant.